Cataract surgery. You've probably heard this term before because the name gets thrown around fairly often. And while the name is a familiar one, I don't think many of us really know what this procedure is. So today, I'm not only going to explain to you what a cataract surgery is, but I'm going to perform one for you to see. And I promise no eyes were harmed in the making of this video. But before we move on to the surgery, I first want to explain what this funny cataract thing is that I keep mentioning. As you probably know, our eyes, similar to a camera, have a lens inside that helps us see. When we're born, our lens looks a little something like this. As you can see, the fibers that make up the lens are arranged in a way such that the lens is clear and allows light to easily pass to the back of the eye where it can be processed. As we begin to age, our lens begins to look a little something like this. What happens is that proteins begin to aggregate within the lens, creating these cloudy blobs that we call cataracts. As you can probably expect, light passing through this lens is going to get scattered in all different directions, and as a result, the image will be blurry. It's similar to wearing a pair of glasses that's covered in oily fingerprints and scratches. You won't be able to see anything. So how do we fix this? Well, a surgeon would go in and remove the old cloudy lens and replace it with a clear artificial one that allows light to properly be focused on the back of the eye. So now that we know what a cataract is and how we can fix it, we can move on to the surgery. But there's just one more thing missing. That's better. I'll see you in the OR.
Alright, so now we're in the OR and ready to get started with our surgery. Before we begin, I did want to note a few things. At this point, our patient has already been given a mydriatic to enlarge the pupil. That's why the iris of this blue-eyed individual is all the way along the edges of the eye. This procedure is also done under topical anesthesia, so the patient is awake for the entirety of the surgery. Also note that I'm using a blue-colored lens here just for presentation's sake. A real lens with a cataract is not blue, rather cloudy. We can now get started, and I do this by first making an incision into the side of the cornea, and then I inject the eye with viscoelastic. This is done in order to maintain the pressure within the eye and to prevent it from collapsing during the surgery. This also protects the ocular structures during the surgery. I then make my second incision at about 60 degrees away from the initial one. Having done this, I can now begin the capsulorhexis. In order to access the actual lens, we must first make a window into the anterior lens capsule, and that's just fancy talk for removing the thin layer that covers the lens. I do this step by using my forceps to peel away a circle within this layer. A trained surgeon usually removes this layer as one piece, whereas in my case I have split it up into two semicircles. I'm trying my best to be as precise and as delicate as possible. When you're working with the eye, you're using a microscope and we're dealing with very small and fragile structures, so it is crucial that I be very careful not to make any damage. I now begin by peeling away the second semicircle of this capsulorhexis. As you can see, I am trying my best to maintain a constant diameter as I go around. This is very important. But as I get towards the end of the second semicircle, I had a little bit of trouble maintaining this diameter. I guess you could tell that I'm not a trained surgeon. Now having performed the capsulorhexis, we can begin the phagoemulsification process, whereby we break up the lens using ultrasonic energy and use a suction to extract the fragments. So I am now dividing the lens into two semicircles, and then I break up each smaller lens into smaller pieces so that I can suction it up. Many surgeons opt to divide the lens into quarters and then suctioning each part separately. As you can see though, working with the lens can be difficult. Using a fluid on the lens to loosen it up from its surrounding structures can help with this issue. This is called hydrodissection. I now continue with the phagoemulsification, and as you can see, the lens can now move around more freely, and this makes the removal process more easy and less prone to damage. Ideally, this technique should be used before phagoemulsification. However, I just wanted to show the difference with and without this method. I really hope the patient doesn't mind our experimentation. I continue breaking up the lens until all we have left is the underlying vitreous humor. As you can see, the vitreous humor is the jelly-like substance that fills the back of the eye. Our intraocular lens has already been rolled up and placed into its apparatus. I now directly insert the lens into the eye and use my instruments to help me set the lens into place. As you can see, this lens is a lot more clear than the previous cataract filled one that we had. We have now successfully removed the patient's old cataract filled lens and replaced it with a new one. The last step is to hydrate the incisions to ensure that we get a watertight seal. At this point, the surgery is complete and will patch up the patient's eye, and they should be ready to head home after this very short and minimally invasive surgery.
Thank you so much for watching this video. I really hope you've gained something from it and learned something new today. If you know me, then you know I love science, and when I stumble upon a fact that I think is interesting, I can't help but sharing it with those around me. For that reason, I'm hoping to begin making more videos just like this one to share interesting ideas with you. I'm thinking this is going to be mostly within the fields of physics and medicine, however, we never know where we'll end up. Thank you so much for watching, and if you've liked it or if you had an idea on what I can do next, please let me know. I would really appreciate it. See you next time.